Pfizer and the aging population. There is a worldwide problem, not only in the US. There are many patients who do not comply with doctors' recommendations, and a large percentage of these are elderly people. A study on the US National Library of Medicine states that between 40% and as many as 75% of older people do not take their medications properly. This poor adherence accounts for 26% of hospital admissions, 25% of nursing home admissions, and costs US healthcare $100 to $289 billion annually. In order to come up with a product, we must first identify and understand the customer group we are aiming at. 500,000 adults in the US hospitalized each year as a result of venous thromboembolism, VTE. It's one of the most common cardiovascular diseases facing adults today, and a person over 60 is 7 times more likely to be affected than a 21-year-old. To further understand the customer group, we can take a look at the biggest concerns amongst the public about life in old age. 3 that are highlighted are that 58% of people worry about losing self-reliance to care for basic needs. 49% of people do not want to be a burden on family or friends, with 21% of people being concerned about taking care of aging parents. As atherosclerosis can lead to a life-threatening condition without the person feeling anything, these 3 statistics are vital when talking about this disease. The product that we're going to offer means that checks and monitoring of atherosclerosis are done in real time, so there is no burden on others to take care of the elderly person. This person can also be sure that they are taking care of this aspect of their health and do not need to worry about losing self-reliance to care for their basic needs. With every problem, there exists an opportunity. Increasing numbers of people in an aging population and increasing numbers of people with heart disease is increasing the size of this market. Pfizer are currently 5th in pharmas for cardiovascular sales. The opportunity to increase this lies in a product that treats cardiovascular diseases aimed at elderly customers. There is already large amounts of growth in the sector, as Eliquis, a drug made by Bristol Myers Squibb with Pfizer used to treat CV diseases, is expected to reach $6 billion in annual sales by 2022 for Bristol Myers Squibb alone. Anticoagulants are drugs that retard or inhibit blood coagulation. Usually, blood clogs will only occur when a blood vessel is damaged, leading to blood loss. This is why it is frequent for people to have to take anticoagulants after surgery. These patients will only take anticoagulants for a short period of time. However, blood clogs can also occur due to several medical conditions that put patients at risk of thromboembolic disease. This creates problems such as pulmonary embolisms, heart attacks, or strokes. Patients at risk need to take anticoagulants for the rest of their lives. Long-term anticoagulant therapy is prescribed every year to 500,000 people in the United States alone. As we have seen, there is a significant correlation between the age and risk of thromboembolic disease, which means that mostly elderly people are on long-term anticoagulant therapy. Anticoagulants have very difficult regimes because they require very frequent monitoring and dosage adjustments. This is due to 4 factors: a small therapeutics window, which means that there is very small difference between the lowest and highest safe dosages, with severe consequences if taken wrong; too little, and there's a risk of vessels obstructions; too much, and the patient could bleed to death. The incorrect dosage of anticoagulants also makes excessive bruising, which can be painful and leads to extreme bleeding if people fall or have an accident. The latter is particularly important for the elderly, as they have worse motor skills, are more fragile, and are therefore more prone to injury. Several drugs, foods, and drinks have interactions that modify the anticoagulant effect. Finally, the doses used vary significantly between individuals to achieve the same effect. For patients, this means a big inconvenience because they have to go to hospital or clinics often to measure their INR, International Normalized Ratio, which measures their blood coagulation, and have their dosage adjusted. Depending on the stability of the patient's INR, monitoring can range from every 3 days to every month. However, studies suggest that only by increasing monitoring from monthly to weekly, desired results are more successful by 35%. This also means that some regimes are overly complicated, with sometimes different dosages for different days of the week. These regimes are complicated for any person, but they represent an even bigger challenge for the elderly. Problems such as simple forgetfulness or even memory loss, which the NHS states that affects 40% of people aged 65 and above, and reduced mobility make it difficult for patients to remember to take the correct dosage and to go to monitoring consultations. This all leads to inefficacy of treatment, which unfortunately can be fatal. The study Oral Anticoagulation and Risk of Death, a medical record linkage study, recorded 1.25 million INR measurements from 42,451 patients. 3,533 died. It was found that mortality from all causes of death was strongly related to level of INR. Meet John. John was a smoker for 50 years, has hypertension and a high cholesterol. John is experiencing more and more memory loss. John has developed atherosclerosis. John is at risk of having a stroke. That is why he has to take anticoagulants. He will have to take them for the rest of his life. As his INR levels are volatile, he needs to go to hospital to measure his levels every week. John also has to restrict what he eats. John's medical history and drug regimes was created to help with the help of a doctor that our group contacted. As we can see, John's drug regimes, Eliquis, is very complicated. John is worried he will not be able to follow this regime because he knows how serious the risk can be. He has bad memory and difficulty reading the doctor's instructions and the packaging, so he has mixed up his pills in the past. This is why John would like to have two connected devices, one that measures his INR levels and another that delivers the anticoagulant accordingly. John wanted this so he can be sure his medication is right and his INR levels are stable, so he can relax without having to go to the doctor as much or have to worry about the consequences of his forgetfulness or poor sight. In order to find out which companies we could potentially partner with in order to create a solution for John, a quick company search was conducted. As a result, the companies connected to medical implants were classified into 5 main areas presented in the picture. Through the search, a company called Microvisc was found. Microvisc is a company that has developed a unique microviscometer based on a novel patented microelectrico mechanical sensor technology. The microcantilever sensor technology determines the blood clotting speed from a finger pricking sample, doing so by using a pair of vibrating cantilevers which are immersed in a blood sample and vibrated quickly. Currently, the device captures and analyzes a sample in one go, similar to a glucose testing kit, and is non-invasive. However, testing the blood viscosity in such a way does not allow continuous measurements to be made, which are needed for the treatment to have the best results. On top of that, the patient could forget or not have a chance to use the device, which would mean that the information would not get to the medicine releasing device in time. Therefore, this alone would not be a suitable option. Now, let's take a look at two types of sensors that are currently used in medicine in order to determine which is more suitable for us. First is non-invasive, where a sensor is positioned on or near the surface of the living tissue. However, this type of sensor is not suitable for our purposes due to problems arising with aging skin, which makes it harder for sensors to be positioned directly on the surface of the skin. The second type is invasive, where a sensing device is placed within living tissues, onto skin or near organs, which is the solution Pfizer is after. John has gone to the doctor and has had a tiny sensor injected in his abdomen. The second part of the process, implanting the drug delivery system also right onto the skin in the abdomen area, required only minor surgery and local anesthesia. So, to make the sensor invasive, we suggest using the already widely used RFID chip. It is a microchip implant about the size of a grain of rice, which is encased in a silicate glass and implanted into a body of a human being. It uses electromagnetic waves to transfer the signal to the reader that can be placed up to several meters away from the chip and has a lifespan of 10 to 15 years, meaning infrequent replacements need to be done. The chip has already been used in glucose sensing, where the sensors are a similar size and work by sampling blood in the same way as the microviscometer, making it possible for Pfizer to combine both technologies in order to produce an invasive blood viscosity sensor. Therefore, the viscometer would be placed on the left-hand side of the chip diagram, where silicon microchip is indicated. Working in conjunction with the sensor is the implantable drug delivery system, which have been experiencing an incremental increase in investments. This is due to the increasingly aging population, with 80% of people over the age of 65 now suffering from a chronic illness. As can be seen by the statistics, there is a huge amount of improvement needed in our health services. This technology has the opportunity to transform the lives of millions worldwide, even more so as we have to cater to an increasingly unhealthy and aging world. With all this taken into account, Business Wire have predicted that the market value of implantable drug delivery systems will be $21.1 billion by 2018. Now, to break down the types of implantable drug delivery systems, they can be either biodegradable or non-biodegradable, although it is expected from the market that biodegradable will grow faster in coming years due to reduced side effects from presence, as well as the fact that no surgery is needed to remove it. Currently, implantable drug delivery systems, similar to that of the contraceptive implant, are being designed to release a therapeutic agent over a long period of time. In this situation, it would release anticoagulants over an extended period to treat the patient without repeated visits to a pharmacy or doctor, and without the need to constantly remember what it is you need to take. One of the main benefits is site-specific drug administration. which allows the drug to be released directly into the bloodstream, allowing it to act quickly and effectively with no waste and minimal doses required. Additionally, the implant allows the drugs to be released slowly, thus minimizing side effects whilst treating the illness in the most effective manner possible. Furthermore, the implant is far less burdensome and improves adherence due to the lack of action needed after it has been inserted. The significance of adherence should not be underestimated as it causes 125,000 deaths a year, contributes to 10% of all hospitalization, and adds unnecessary healthcare costs of 100 to 289 billion US dollars annually in the US, according to the Annals of Internal Medicine magazine. Now, the implant would work by utilizing a sensor, as you were shown previously, in conjunction with the implantable drug delivery system underneath the skin of the abdomen. The small microchip-like implant is embedded with hundreds of reservoirs, each holding a dose of the therapeutic agent. A radiomagnetic wave is transmitted to the device from the sensor, which opens a metal-capped membrane that releases one dose. Using this method, the implant will be able to release doses for up to 16 years following its original insertion. John has gone to the doctor and has had a tiny sensor injected in his abdomen. The second part of the process, implanting the drug delivery system, also right on the skin in the abdomen area, required only minor surgery and local anesthesia. John wasn't afraid to have these procedures done as the doctor explained to him that this device is more than 100 times smaller than the pacemaker that John's wife had put in just 1 month ago. John's INR levels are more constant than ever. He will have better results, thus living a longer and easier life. The sensor will be constantly sending information to the drug delivery system. The latter has different sized reservoirs that are activated based on INR ranges incoming from the sensor. The specific ranges and dosages will be programmed based on the patient's doctor instructions. Drug is released directly to the bloodstream in frequent small quantities, thus promoting bigger stability and efficacy. John could also be helping the future of medicine and of Pfizer by giving consent for the data collected from his sensor to be used by Pfizer for research purposes. Before deciding to invest in this technology, we must first look at Pfizer's financial capability. Teva, a medicine-focused pharmaceutical company that made a joint cooperation with Microchips Biotech of MIT, spent $35 million for the initial research fee of a smart pill technology. Comparing Teva and Pfizer, we can clearly see that Pfizer performed twice better than Teva in 2015 profitability. Pfizer's R&D expenses is $7.69 billion and their $72 billion retained earnings are ready to be spent. The initial cost would only be 0.4% of its total R&D expense. So, investing in this technology will not be a problem for Pfizer at all. A report done by Global Industry Analysts Inc. predicted that the global anticoagulant market would grow from $19.5 billion in 2015 to $29.6 billion in 2020. It has 7% compound annual growth rate, which is the average of the predicted annual growth. US represents the majority of the market with 44% market cap and 6.67% growth rate. Meanwhile, Asia is leading the growth with 10.3% CAGR. In order to forecast the financial benefit, we need to compare it with Pfizer's current anticoagulant drug, Eliquis. An anticoagulant drug that is jointly developed by Pfizer and Bristol Myers Squibb has no specific financial data, and they have not released the data, even though it was presented at the ESC Congress in late 2015. So we use Fragmin, an injectable anticoagulant, as a comparison. Fragmin bought Pfizer $335 million revenue in 2015. Combining the given data, if we release the advanced anticoagulant delivery technology today and the price was $3,600 with 33% markup, the revenue generated by the technology would be $871 million in 2015. Here are all the calculations. To summarize, there are two financial benefits to highlight. The revenue will grow by 260% in 10 years, and higher profitability due to a higher markup price. The storage and logistic costs will decrease by a whopping 99.7% from storing and delivering 45 million units of Fragmin to 123,000 units of implantable anticoagulant. Because of those reduced unit costs of sales and a higher markup, the profitability would increase greatly. In the short run, where we use technology as a substitute of Fragmin and Eliquis, we can enjoy revenue growth and a huge reduction in storage costs. In the long run, phase 1, where we completely substitute the traditional anticoagulant, we can enjoy a maximized logistics operation and a huge profit growth. However, putting the technology in anticoagulant drugs doesn't give a significant revenue growth for the company. If the investment is proven to be successful, we can implement the technology in all other drugs, so that the financial benefit would be much higher as the logistics cost of the whole pharmaceutical product segment of Pfizer were reduced by 99.7%. The company would also enjoy a highly sustainable company growth as they follow corporate social responsibility by introducing biodegradable and profitable products that benefit the community. As a result of all these benefits, we suggest that you invest in this technology. Thank you.